briefing. Well, the British Psychological Society has told the BBC that the UK is running the risk of a future mental health crisis and a generation of burnt-out health workers. This comes after a cross-party group of MPs have written to the Health Secretary, Matt Hancock, calling for psychological first aid and support for frontline workers during the coronavirus pandemic. Well, the SNP's Lisa Cameron is a clinical psychologist and one of the MPs to sign this letter. Thanks very much indeed for being with us here on BBC News. Just explain what your concerns are for frontline staff dealing with this crisis.
Yeah, I mean, as chair of the Health All-Party Parliamentary Group and the Psychology Group in Parliament, we've been working very closely with the British Psychological Society. We know that staff who are on the front line in care homes, in the NHS, in ambulance services, etc., they are experiencing trauma alongside the physical demands of the job just now, and we think it's absolutely crucial that they are provided with mental health supports at this time.
Chris Hopson, the CEO of NHS providers, I was speaking to him in the last hour or so, and he made it clear that there now has to be a focus on the mental health of NHS frontline staff dealing with this crisis, and that perhaps this is a time bomb that could well explode at some point in the future.
Absolutely, because trauma doesn't always hit people at the time of the experience of the crisis, but it will be starting to have an impact upon staff. Not only are we putting staff on the front line to care for people who are dying, they're helping the families of those who are bereaved. They're also losing colleagues, which is something that they wouldn't perhaps have expected to see in their lifetime of service in the NHS or in care services. Therefore, this is an unprecedented situation. It is, as I said, a ticking time bomb, and we really need to address mental health needs with parity to the physical health needs that we need to make sure staff have essential PPE as well.
A Department of Health and Social Care spokesperson has said, "We share the concerns that this epidemic poses challenges to mental health and the well-being of all our health and care workers. A £5 million grant is available for mental health charities to fund additional services for people who are struggling with all this, and that ministers say NHS staff can call a helpline if they're feeling stressed." Is any of this enough?
We think that that's a really good start, but it's certainly not enough. It's excellent that people can call a helpline. Having charities fund this and take this forward in itself, we don't think is enough, because that might mean that it's a postcode lottery for staff in different parts of the country, depending upon which charities are set up and where. It really needs more central government coordination to be dealt with through the NHS, and to include psychological first aid, which is a specialist type of therapy to help prevent post-traumatic stress disorder in those frontline staff who have experienced crisis and trauma.
And what about those frontline staff who have literally just come out of medical training, want to do their bits, they're now on the front line, and they're seeing things that, you know, frankly, a more experienced NHS worker might not see for many years in the job?
You're absolutely correct, and that's one of the key issues. We're very concerned because staff are desperate to be there, to be doing their bit from the get-go, and we absolutely commend them for that, but we have to be providing them with all of the mental health supports that they need in order to deal with these circumstances, to develop coping strategies, to make sure that they're not burning out before they've even started, and to make sure that where they experience trauma, they have that support as soon as they need it, and that's actually now.
Indeed. All right, Liz Cameron from the SNP. Thanks very much indeed for joining us, Liz. Thank you.